Welcome to Neurology News Network. I'm Marco Meglio. Let's get into the news from this week. SK Life Science has announced that its newly approved treatment for partial onset seizures in adults, Sonova Mate, has been designated as a Schedule 5 medicine by the DEA, the lowest designation for abuse from the agency. The sodium channel antagonist was originally approved by the FDA for this indication in late November of 2019, with the approval supported by data from pivotal trials that assessed the efficacy and safety of Sonova Mate in more than 1,900 total patients. It was shown to significantly reduce partial onset seizure frequency, with up to 20% of patients achieving seizure-free status during the maintenance phases. Sonova Mate is expected to launch in the second quarter of 2020. The Institute for Clinical and Economic Review has released its final evidence report and accompanying report at a glance on the clinical effectiveness and economic value of a trio of recently approved acute migraine treatments. They include lasmiditan, rimegepant, and abrogepant, deciding that the available evidence suggests with moderate certainty that all three offer a small or substantial net health benefit, and with a high certainty of at least a small net health benefit. Clinical trial data suggests that the therapies all decrease symptoms of migraine attacks and improve function compared with placebo for those who are unable to take triptans. And ICER noted that those who can, its indirect comparisons imply that triptans are similar or more effective than those newly approved agents. ICER noted that without evidence showing superiority to other, less expensive options, clear and effective prior authorization criteria based on clinical evidence, specifically society guidelines, and input from clinical experts and patient groups would be reasonable to develop to ensure practical use of those therapies. The FDA has approved a labeling update for NeuroPace's responsive neurostimulation system, allowing treatment for patients with non-brain MRI requirements and individuals with focal onset seizures that require monitoring for brain abnormalities such as tuberous sclerosis complex, brain tumors, or multiple sclerosis. The FDA's decision was based off a real-world study that showed an 82% median seizure frequency reduction at 3 years, with 1 in every 3 patients achieving 90% or greater seizure reduction. The latest approval of MRI labeling for the RNS system may add an additional treatment option to the anti-seizure armamentarium for those with refractory epilepsy who were previously restricted by the need for necessary imaging. For more direct access to expert insight, head to neurologylive.com. This has been Neurology News Network. Thanks for watching.